Well, hello everybody, and welcome to another fabulous, scintillating, informative, educational, fantastic episode of Wellness Wednesday. I'm Wendy Bell. You know this. Dr. Darren Dubiak from Advanced Integrative Medical 360. I think everybody at this point knows who you are 100%.
Yes, and thank you because of that. It's because of you they do. And I think it, and I love the intro. Oh, they do. It's because of you. And that intro, I always think, wow, how can we make this more fun as an intro? You always up the game. I love it.
You know, what we're talking about today, I think is super important because I think a lot of people, they hear me speak about what you do every single day on my program. They might watch your videos here or there or all of them. But what you do in integrative medicine is so different than what we are traditionally receiving from our doctors in general. And this is a great time to discuss the difference.
Agreed. And I love it because the bigger and bigger we get, a lot of people are saying, well, what is this integrative thing?
Right.
We use this word and this traditional medicine or functional or holistic care, all this stuff.
Right.
So we said, you know what? Today's a great way. Let's get into it.
Please.
So traditional medicine and integrative medicine.
Right.
Two separate things. So I broke it up into this. So we see traditional medicine, I mean, when do you think about it? Treating symptoms. You have a headache, you go to your doctor, what's given to you?
Some pain medication.
Wendy, you haven't been feeling great, you haven't been yourself the past 3 or 4 weeks, you go to your doctor, what do they give you?
Some medicine.
Oh, okay. Wendy, wait a minute. So you're telling me even your stomach's not feeling right, you go to your doctor, you haven't pooped in 4 or 5 days, you know, you go to your doctor, what do they give you?
I'm thinking some medicine.
Oh, it's medicine.
Right.
Oh. But why aren't they taking the time to find out?
Why?
Say it again?
Why?
I'll tell you what, we didn't even script this.
Why? What's wrong with you, right?
Why?
Tell me.
Why? So a big difference of what integrative medicine doctors do and what we do is we treat the underlying cause. When do you go to, why are you having headaches? Is it that time of the month? Are you dehydrated? Was blood work done? Is there just sitting down, going through with a patient and just not saying, here.
Take 2 of these and don't call me in the morning.
You got it. It's the most, I've been in medicine for over 20 years, over 19 years, and still to this day, I cannot imagine how much we just give medication for things.
Correct.
And things, by that big word, why?
How many people do you think open up their, I don't even have a medicine cabinet because I take a multivitamin. That's it. So how many people have medicine cabinets that are like,
you got it. See, you have to think about it. We are young still, right? And
wow.
We're still, go with me on it.
Okay, go ahead.
And you know, when we were younger, we always thought old people take the medication, right? It's not that like that
anymore.
People are
getting prescribed things in their teenage years.
And they're staying on them since they're teenagers. It's things that we see as a medical team here that we can't believe. And that's why we do this integrative care. You know, think about it. Next when you have traditional medicine, there's multiple doctors, right? So think about it. So you have a headache, right? Well, I don't know why that's happening. Why don't you go see a neurologist, right? And then if that's not happening, maybe you're just so depressed and things aren't, well, now I want you to go see a psychiatrist, right? It's multiple chains. And guess what? A lot of the times, if any, those doctors never talk. So they don't know. And not only do they not ever talk,
true.
Try getting an appointment right now with a specialist.
Right.
4 months, 6 months, 8 months, and you have these problems now.
Right.
You're gonna wait that long?
No.
When you see an integrative team, and especially at Advanced Integrative Medical 360, we have a team of health practitioners. Wendy, listen, we have medical doctors on staff. We have nurse practitioners on staff. We have nurses. We have registered dietitians on staff. We have health coaches on staff. Hey, guess what? We all talk. Kind of neat, right?
Right.
I mean...
What a novel idea.
I mean, holy moly, you're coming to see us. Wouldn't it be kind of cool that whole medical team is looking over your care?
Yes.
That is AIM 360. 10 to 12 biomarkers, lab test storing I wrote. And I gave that as a, all right. So we talked about you're not feeling great, right? You got a headache, you're down, and
well, yeah, because I have a headache.
Yeah. and you're constipated. So not only you have that, you can't poop, you don't feel right, and you're down. So your doctor's going to say, all right, well, let's get some blood work done, right? Usually they'll order what's called a CBC. They'll look for different blood panels, your lipid panels, your cholesterol markers, you know. And once in a blue moon, and hopefully your doctors will order maybe a TSH, a thyroid marker, right? Wendy, how are just 10 or 12 biomarkers going to tell you what's going on with you? So why do your doctors keep doing that then?
Huh.
Again, funny word, love it though. Why? So at Advanced Integrative Medical, I order 60 to 70. Think about it, you're a certain age. Is it hormonal? Is it that time of the month? If it's not, is it I ate the red thing? It's you know, this is how I don't even want to say the adjective I want to use right now, but I have a lot of people that will go to a special hormone doctor, a gynecologist, or things like that, and their hormones aren't even checked.
What?
It has to be the most dumb thing I've ever heard. I'm dumbfounded every time I see these patients. Like, well, they didn't check all those hormones like you do. Why? They're supposed to be that specialist to do it. Completely dumbfounded. Next, medication-only treatments. We already talked about it, right? I mean, seriously, think about it. You have a headache, take this. You don't feel good, you're down on yourself, and here's what's even more scary. Let's say you go to your doctor and they'll say, you know, well, how long has this been going on? And hopefully they're asking you those questions. Some of my patients come in and say they don't ask these questions, how long it's happening. It's just, here you go. There is other options. At Advanced Integrative Medical, we have nutritional supplements, medication therapies. Listen, I am that functional medicine provider. I'm looking over all diets, supplements. Our nurse practitioner, Allie, have you guys always see, she's looking over with our other medical team members for different medications that may help you. Oh, and guess what? There's a really neat word. It's called diet, or food that we put in our mouths. When the hell is the last time your doctors ever really sat down with you and went over what food you should be eating? I mean, let's be real here. I mean, when's the last time, and I already said this on another show, when's the last time that your doctor sat down with you and said, listen, I really want you going over this food program. I want you eating like this. I mean, Wendy, after all, a lot of things I just told you, hey, you haven't pooped right. Maybe you're down on yourself and you have a headache. Are they allergens? Are those foods you just can't eat? They may make you heavier. I mean, doesn't it start with diet in the first place?
Aren't you what you eat? I mean, isn't that what we're told as
we've only been
kids?
saying this for, you know,
millennia.
Hundreds of years, right? But we just
the thing that also
this.
kills me about a regular traditional doctor, and God bless them, they're trying to get you in and out, but no, not. I had a gynecological exam that took 7 minutes. In, out, 7 minutes. I wasn't asked about anything, like what? And I said, I'm going to probably need a colonoscopy since I'm over 50, and they're like, you probably will.
Any more? You just literally led me into this.
What?
We have more patients dictating their care when they're at their medical practitioner than I've ever seen in practice in my entire life. Listen, when your doctors have 5 or 10 minutes maybe max
exactly
with you,
it.
and that's all that's happening. You know, I'm like, a lot of my patients will come in and say, Dr. Dubiak, you ask so many questions. I sometimes feel like, is this a psychology? No, it's me trying to figure out why and what's going on and why these things are bothering you. And again, I get so loud and so animated because it's so frustrating.
People here who come here sit with you or one of your practitioners for like more than a half of an hour.
Listen, our next video, I'm going to break down the AIM 360 7-step process of what happens, because a lot of your listeners, right, and a lot of my patients who watch you and follow you are so awesome, they're even telling other people who are watching you, hey, this is my success, this is how it happened.
It's about.
You got it. So I said, you know what, we're going to do a video exactly of what AIM's 360 process is.
Smart.
So like you said, 30 or 45 minutes with me. You're sitting with a professional going over all this.
talking about you, your blood work, your everything.
It's amazing, isn't it?
That's more time than I spend with my husband.
Okay.
I mean, like, seriously.
It's true, though. It's true. You know, and then the next item I want to go over, and I know you're going to love this, is the insurance stuff. Deductibles, co-pays, co-insurance, in-network, hidden pricing. Listen, I have insurance. I have a deductible. Then I have this thing called a copay. Oh, and then there may be hidden things. I mean, think about it. Just the other day, my niece goes to a pediatric dentist, right? She has a $518 bill that her insurance is going to cover. A week later, my brother calls me and says, "You're not going to believe this. The insurance went through, but they needed this, this, and this. And it was you only are covered at 80%. Oh, I'm sorry. So not only were you given that bill, it's covered at 80%. Oh, and Wendy,
you have a deductible.
They had a deductible and a copay. So what?
So how much did he have to pay?
Over $1,100.
What?
So tell someone that's not ready for those things. I mean, think about it. People say,
no wonder people don't want to go to the doctor.
You got it. Or if they do, they say, well, I have insurance. See, a lot of people are under this mindset that I have insurance and everything's covered. No. What happens if you have a $2,500, $5,000 deductible, like most people do nowadays? Nothing's covered until that deductible gets hit and met first.
Right.
Me, what we do here, everything's transparent. I love it. You know what? You're going to see what you pay. As I tell every single patient, Integrative Medical 360, every pricing of every test is there. There's no hidden cost.
Right.
People say, well, Dr. Dubek, what's this stuff cost when I see you? Hey, listen, some programs are a couple $100 a month, some are $800 a month. If you are over 100 pounds, you have a headache, you haven't pooped, right? Your program is going to be more than $20, right? But at the same time, you have to think about it. How much are, and Wendy, even more, see, here I go, I get excited. You have your insurance that you're already paying a monthly fee to even have.
What's it doing for you?
Anymore, I see a family of 4, and I'm going to be very generous with $1,000 a month. Let's say $1,000 a month. That's $12,000 a year just to have health insurance.
Before you even use it. Before you reach your deductible, before you pay copays, before your doctor has to be on the phone to try to finagle whether or not that procedure is covered.
Oh, so you mean you're going to talk about this one next? Let's get into authorizations. Because why? And I even get more excited about this. I hurt myself about 7 months ago, and I had to get authorization to go. Are you kidding me? Because my insurance may have not authorized this test. You got to be kidding me anymore. So I have an algorithm telling the insurance company if this guy can even get this procedure done.
They're not there talking to you.
Is that insurance company in the room with you and your doctor?
No.
It's preposterous. It's actually, I believe, the complete downside of what's happening in medicine right now. It's ridiculous.
All of this jazz.
You got it. Oh, and then the whole one-size-fits-all approach, right? Meaning, here, you're a certain age group. Let's say someone is in their 70s and someone's 15, all has headaches. You think you guys are all going to get the same medication, Wendy? Take a wild guess.
I'm going to say yeah.
I would say yes too, right? At Advanced Integrative Medicine, it's personalized nutrition-based care. Again, from myself, our medical team, looking at different foods, looking at different supplements, medications, all combined because you are different than anybody else.
I say it's one-on-one. I say it changes your life. It changes your life. And this isn't, look, that's the difference.
Yeah.
And I know you get animated because this has become a tragic failure in the career that you work so hard to become certified to be a part of.
Wendy, when you have some of the top diseases in this country being chronic diseases, meaning sugar-related, diabetes, blood pressure, obesity, Are you kidding me that food isn't talked about during these damn doctor visits? You have to be out of your mind. And see, I'm already getting angry. This is why I get so, and me when my patients, when they come to say, wow, you really are like this. Because this should make you mad that it ain't happening.
Nobody's going to change your life until you manage to pick up the phone and give them a call. Go to the website, okay? Here's the number, 412-227-9255. Advanced Integrative Medical 360, integrativemedical360.com. Go there. It's all spelled out for you. There's no mystery. There's just passion and knowledge and this one-on-one.
You got it.
Dr. Dubiak, I can't thank you enough.
Thank you.
Do I need to detox you?
I think I need a glass of water. I need more than a glass of water, I think, right now. Because I knew this. This is why I practice the type of medicine we do here. And all of my medical team, all of us, we're so passionate that this is why we do this. So guys, thank you so much.
Thank you very much. We'll see you next week. Peace.